It is my pleasure to speak about this paper on radial access for peripheral vascular interventions as the vice chair of this paper presentation committee. It was a really wonderful thing to be part of getting radial access off the ground for coronary interventions many years ago. And now we are embarking on a new process to get the materials in place, the equipment in place to be able to do successful peripheral vascular interventions using a radial approach. What this paper is describing is trying to identify what are the barriers to doing peripheral vascular interventions with a radial approach. We know that we need more equipment and we likely need some more randomized controlled trials. But the data is so compelling that using radial access for coronary interventions saves lives that it behooves us to look into this further. This paper was written to provide some guidance to the groups engaging in this process and starting to use radial access for peripheral vascular interventions on a regular basis. There are a number of previously reported clinical trials in this area. They are mostly single center trials, and the data is accumulating that this is safe and decreases the risk of bleeding and decreases the risk of morbidity following these interventions. The data is continuing to be collected from single center clinical trials, and we need to do randomized clinical trials to show that radial access is safe and decreases the mortality and morbidity in peripheral vascular interventions. What this paper describes is some of the techniques that are used, some of the limitations that we currently have, and what are the future areas that we need to study in order to adopt this access site as our preferred access site in peripheral vascular interventions. The likelihood is that this will not be adopted for all patients and that we will need to carefully select the patients that we utilize a radial approach. But when appropriate and when safe, the use of radial access for these interventions could potentially save lives.